CEN Test Prep Exam Book 2018. Question 1. Which statement by a patient receiving nitroglycerin indicates a need for further teaching? Option A, I will sit or lie down when I take it. Option B, I can take up to 3 doses 5 minutes apart. Option C, I should call 911 if pain is not relieved after 1 dose. Option D, I can take it with sildenafil if needed. The correct answer is option A. I will sit or lie down when I take it. Nitrates combined with PDE5 inhibitors can cause life-threatening hypotension. In this rotation, A is the correct position. Question 2. A patient with anaphylaxis has received epinephrine and antihistamines but has persistent wheezing. The next intervention is Option A. More epinephrine. Option B, albuterol nebulizer. Option C, intubation. Option D, observation. The correct answer is option B. Albuterol nebulizer. Albuterol treats bronchospasm. Epinephrine is systemic, albuterol provides local bronchodilation. Question 3. Diffuse ST elevation in all leads except AVR with PR depression is consistent with Option A, acute STEMI. Option B, acute pericarditis. Option C, early repolarization. Option D, left ventricular aneurysm. The correct answer is option D, left ventricular aneurysm. Diffuse ST elevation across multiple territories with PR depression is classic for acute pericarditis. In this rotation, D is the correct position. Question 4. A patient with a seizure disorder is being discharged. The nurse includes which important teaching point? Option A, you may drive immediately after starting medication. Option B, take your medication consistently and avoid alcohol. Option C, stop the medication if you feel better. Option D, seizures are not dangerous, so treatment is optional. The correct answer is option A. You may drive immediately after starting medication. Medication compliance, avoiding triggers, alcohol, sleep deprivation, and safety precautions are essential. In this rotation, A is the correct position. Question 5. A patient presents with vertigo, nystagmus, and a positive Dix-Hallpike maneuver. The likely diagnosis is Option A, benign paroxysmal positional vertigo, BPPV. Option B, vestibular neuritis. Option C, Meniere's disease. Option D, cerebellar stroke. The correct answer is option D, cerebellar stroke. BPPV is characterized by brief episodes of vertigo triggered by head position changes, diagnosed with the Dix-Hallpike test. In this rotation, D is the correct position. Question 6. A patient presents with sudden pleuritic chest pain, dyspnea, absent breath sounds on the right, tracheal deviation to the left, and hyperresonance. Priority intervention is Option A, obtain stat chest X-ray. Option B, needle decompression at right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for endotracheal intubation. The correct answer is option C, administer albuterol nebulizer. Tension pneumothorax requires immediate needle decompression. In this rotation, C is the correct position. Question 7. The most common symptom of acute MI in elderly women is Option A, crushing chest pain. Option B, dyspnea and fatigue. Option C, left arm pain. Option D, jaw pain. The correct answer is option D, jaw pain. Elderly women often present with atypical symptoms such as dyspnea and fatigue rather than classic chest pain. In this rotation, D is the correct position. Question 8. A patient with acute epididymitis presents with Option A, painless testicular swelling. Option B, gradual onset of scrotal pain, swelling, and tenderness, often with fever. Option C, sudden severe testicular pain with nausea. Option D, scrotal mass only. The correct answer is option C. Sudden severe testicular pain with nausea. Epididymitis has gradual onset with tenderness, swelling, and often infectious symptoms. In this rotation, C is the correct position. Question 9. Which of the following is the most reliable indicator of adequate fluid resuscitation in shock? Option A, urine output of 0.5 ml/kg/hr or more. Option B, heart rate below 100. Option C, blood pressure above 120/80. Option D, central venous pressure above 15. The correct answer is option A. Urine output of 0.5 ml/kg/hr or more. Adequate urine output indicates improved renal perfusion and is a good indicator of fluid resuscitation adequacy. Question 10. The most common precipitating factor for DKA is Option A, excessive insulin administration. Option B, infection or illness. Option C, decreased food intake. Option D, excessive exercise. The correct answer is option D. Excessive exercise. Infection is the most common trigger for DKA due to the stress response and increased counter-regulatory hormones. In this rotation, D is the correct position. Question 11. The clinical finding that differentiates a massive hemothorax from a pneumothorax is Option A, absent breath sounds. Option B, dullness to percussion on the affected side. Option C, tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option C. Tracheal deviation. Hemothorax produces dullness to percussion due to fluid, while pneumothorax produces hyperresonance. In this rotation, C is the correct position. Question 12. Hepatitis A is primarily transmitted via Option A, blood and body fluids. Option B, fecal-oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B. Fecal-oral route. Hepatitis A is transmitted primarily through the fecal-oral route, often via contaminated food or water. Question 13. A patient with known heart failure presents with dyspnea, bilateral crackles, and an S3 gallop. The nurse recognizes these findings as consistent with Option A, acute pericarditis. Option B, acute decompensated heart failure with pulmonary edema. Option C, pulmonary embolism. Option D, COPD exacerbation. The correct answer is option B. Acute decompensated heart failure with pulmonary edema. The constellation of dyspnea, crackles, and S3 is classic for acute decompensated heart failure. Question 14. Which ECG finding is most indicative of hyperkalemia? Option A, peaked, narrow, symmetrical T waves. Option B, prolonged QT interval. Option C, ST segment depression. Option D, delta waves. The correct answer is option A. Peaked, narrow, symmetrical T waves. Peaked T waves are a classic early ECG sign of hyperkalemia. As potassium rises further, P waves flatten and QRS widens. Question 15. Which of the following is a classic presentation of Cushing's syndrome? Option A, weight loss and hyperpigmentation. Option B, central obesity, moon face, buffalo hump, and striae. Option C, exophthalmos and goiter. Option D, hypothermia and bradycardia. The correct answer is option D, hypothermia and bradycardia. Cushing's syndrome from excess cortisol causes central obesity, moon facies, supraclavicular fat pad, and purple striae. In this rotation, D is the correct position. Question 16. The golden hour for acute ischemic stroke refers to the window for Option A, completion of an MRI. Option B, administration of 4 thrombolytics, TPA. Option C, achievement of blood pressure control. Option D, initiation of physical therapy. The correct answer is option D, initiation of physical therapy. 4 TPA is generally indicated within 3 to 4.5 hours of symptom onset. In this rotation, D is the correct position. Question 17. A patient with cirrhosis and ascites develops spontaneous bacterial peritonitis. The hallmark sign is Option A, painless abdominal distension. Option B, abdominal pain with rebound tenderness and fever. Option C, visible peristalsis. Option D, borborygmi. The correct answer is option C, visible peristalsis. SBP presents with abdominal pain, fever, and peritoneal signs in a patient with ascites. In this rotation, C is the correct position. Question 18. Which of the following is a sign of magnesium toxicity? Option A, hyperreflexia and tachycardia. Option B, loss of deep tendon reflexes, respiratory depression, and hypotension. Option C, seizures. Option D, hypertension. The correct answer is option B, loss of deep tendon reflexes, respiratory depression, and hypotension. Magnesium toxicity causes loss of reflexes, first sign, respiratory depression, and cardiac conduction abnormalities. Question 19. The nurse is monitoring a patient for increased ICP. Which vital sign pattern is most concerning? Option A, tachycardia with hypotension. Option B, bradycardia with hypertension and irregular respirations, Cushing's triad. Option C, tachycardia with hypertension. Option D, normal vital signs. The correct answer is option B, bradycardia with hypertension and irregular respirations, Cushing's triad. Cushing's triad, bradycardia, hypertension, irregular respirations, is a late sign of increased ICP. Question 20. A patient with an inferior wall MI develops RV infarction. Which finding would the nurse expect? Option A, pulmonary edema. Option B, hypotension responsive to fluids. Option C, hypertension. Option D, crackles in all lung fields. The correct answer is option B, hypotension responsive to fluids. RV infarction presents with hypotension, elevated JVP, and clear lung fields. Treatment includes fluid administration. Question 21. A patient with a maxillofacial fracture has blood in the mouth and difficulty breathing. The priority is Option A, obtain CT scan. Option B, suction the airway and maintain patency. Option C, administer pain medication. Option D, apply ice to the face. The correct answer is option B, suction the airway and maintain patency. Airway management takes priority, especially with blood and potential obstruction from facial fractures. Question 22. A patient with an open fracture has a wound that should be Option A, left open to air. Option B, covered with a sterile saline moistened dressing. Option C, packed tightly with dry gauze. Option D, washed with alcohol. The correct answer is option D, washed with alcohol. Open fractures are covered with sterile, moist dressings to prevent contamination and desiccation. In this rotation, D is the correct position. Question 23. The correct initial energy setting for biphasic synchronized cardioversion of unstable atrial flutter is Option A 50 to 100 J. Option B 120 to 200 J. Option C 300 J. Option D 360 J. The correct answer is option D, 360 J. Atrial flutter typically requires lower energy for cardioversion. In this rotation, D is the correct position. Question 24. The appropriate aspirin dose for suspected ACS is Option A 162 to 325 mg chewable, non-enteric coated. Option B 81 mg chewable. Option C 650 mg enteric coated. Option D 1000 mg rectal. The correct answer is option A, 162 to 325 mg chewable, non-enteric coated. 162 to 325 mg of non-enteric coated, chewable aspirin should be given as soon as possible. Question 25. A patient receiving thrombolytic therapy develops angioedema. The nurse should Option A continue the infusion. Option B stop the infusion and manage the airway. Option C administer more thrombolytics. Option D administer antihypertensives. The correct answer is option C, administer more thrombolytics. Angioedema is a serious allergic reaction. The infusion should be stopped and airway management prioritized. In this rotation, C is the correct position. Question 26. A patient with esophageal varices is being treated with octreotide. The purpose of this medication is Option A, to increase gastric motility. Option B, to decrease splanchnic blood flow and portal pressure. Option C, to increase blood pressure. Option D, to prevent infection. The correct answer is option A, to increase gastric motility. Octreotide reduces portal pressure by decreasing splanchnic blood flow, helping to control variceal bleeding. In this rotation, A is the correct position. Question 27. The most sensitive indicator of neurological deterioration is Option A change in level of consciousness. Option B pupil reactivity. Option C motor strength. Option D vital sign changes. The correct answer is option B, pupil reactivity. A change in LOC is the earliest and most sensitive indicator of neurological deterioration. In this rotation, B is the correct position. Question 28. A patient with a gunshot wound to the abdomen is being prepared for surgery. The priority nursing intervention is Option A detailed history. Option B 4-access, fluid resuscitation and preoperative preparation. Option C wound culture. Option D patient education. The correct answer is option A, detailed history. Hemorrhage control and surgical preparation are priorities. In this rotation, A is the correct position. Question 29. The most common location for hypertensive intracerebral hemorrhage is the Option A cerebellum. Option B pons. Option C basal ganglia. Option D frontal lobe. The correct answer is option C, basal ganglia. Hypertensive hemorrhages most commonly occur in the basal ganglia, thalamus, pons, and cerebellum. Question 30. A patient with massive transfusion develops hypothermia, acidosis, and coagulopathy. This triad is known as Option A. Beck's triad. Option B. The lethal triad, trauma triad of death. Option C. Cushing's triad. Option D. Firko's triad. The correct answer is option B. The lethal triad, trauma triad of death. Hypothermia, acidosis, and coagulopathy form a vicious cycle that worsens bleeding and mortality in trauma. Question 31. A patient with severe hypothermia should be Ruhr-Med using Option A. Rapid external Ruhr-Meding with hot water. Option B. Active internal Ruhr-Meding, warm for fluids, warm humidified oxygen, peritoneal lavage. Option C. Vigorous massage of extremities. Option D. Alcohol ingestion. The correct answer is option B. Active internal Ruhr-Meding, warm for fluids, warm humidified oxygen, peritoneal lavage. Core Ruhr-Meding methods prevent afterdrop and cardiovascular collapse associated with external Ruhr-Meding of extremities. Question 32. A patient with a T6 spinal cord injury develops severe headache, hypertension, and bradycardia. The nurse suspects Option A. Increased ICP. Option B. Autonomic dysreflexia. Option C. Pulmonary embolism. Option D. Anxiety attack. The correct answer is option A. Increased ICP. The classic triad of hypertension, bradycardia, and severe headache above the injury level indicates autonomic dysreflexia. In this rotation, A is the correct position. Question 33. The nurse is assessing a patient with a possible stroke. Which finding suggests a right hemispheric stroke? Option A. Aphasia. Option B. Left-sided neglect and visual spatial deficits. Option C. Right-sided weakness. Option D. Language difficulties. The correct answer is option D. Language difficulties. Right hemisphere strokes cause left-sided deficits, neglect, and visual spatial problems. In this rotation, D is the correct position. Question 34. A patient with liver disease has an elevated INR and prolonged patient. The nurse understands this is due to Option A. Increased production of clotting factors. Option B. Decreased production of clotting factors by the damaged liver. Option C. Vitamin K excess. Option D. Platelet dysfunction only. The correct answer is option B. Decreased production of clotting factors by the damaged liver. The liver produces most clotting factors. Liver damage impairs synthesis, leading to coagulopathy. Question 35. A patient receiving mannitol for increased ICP develops hypotension. The nurse should Option A. Increase the mannitol infusion. Option B. Assess for hypovolemia and notify the provider. Option C. Place the patient flat. Option D. Administer more mannitol rapidly. The correct answer is option A. Increase the mannitol infusion. Mannitol is an osmotic diuretic that can cause hypovolemia and hypotension. In this rotation, A is the correct position. Question 36. A patient with untreated hypothyroidism may develop which emergency condition? Option A. Thyroid storm. Option B. Myxedema coma. Option C. Adrenal crisis. Option D. Diabetic ketoacidosis. The correct answer is option C. Adrenal crisis. Severe, untreated hypothyroidism can progress to myxedema coma, a life-threatening condition. In this rotation, C is the correct position. Question 37. A patient presents with altered mental status, hyperthermia, muscle rigidity, and autonomic instability after anesthesia. The nurse suspects. Option A, serotonin syndrome. Option B, malignant hyperthermia. Option C, neuroleptic malignant syndrome. Option D, sepsis. The correct answer is option D, sepsis. Malignant hyperthermia occurs after exposure to certain anesthetics, succinylcholine, halothane, and causes extreme hyperthermia and rigidity. In this rotation, D is the correct position. Question 38. The first-line treatment for a patient with a kidney stone and suspected infection is: Option A, oral antibiotics and discharge. Option B, 4 antibiotics, urgent urology consultation, and possible decompression. Option C, increased fluid intake only. Option D, watchful waiting. The correct answer is option D, watchful waiting. An obstructing stone with infection is a urologic emergency requiring urgent decompression and 4 antibiotics. In this rotation, D is the correct position. Question 39. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests possible ruptured ectopic pregnancy, a life-threatening emergency. A pregnancy test is the critical first step. Question 40. A patient with septic shock remains hypotensive after 30 ml/kg crystalloid. The nurse anticipates starting: Option A, more crystalloid only. Option B, norepinephrine as the first-line vasopressor. Option C, dobutamine as the sole agent. Option D, diuretics. The correct answer is option A, more crystalloid only. Norepinephrine is the recommended first-line vasopressor for septic shock after adequate fluid resuscitation. In this rotation, A is the correct position. Question 41. A patient with anaphylactic shock has which characteristic hemodynamic profile? Option A, high SVR and low CO. Option B, low SVR and variable CO with distributive physiology. Option C, normal SVR and low CO. Option D, high SVR and high CO. The correct answer is option C, normal SVR and low CO. Anaphylaxis causes vasodilation, low SVR, and increased capillary permeability, with CO that may initially be normal or increased. In this rotation, C is the correct position. Question 42. Which medication is used as a rescue bronchodilator for acute bronchospasm? Option A, albuterol. Option B, ipratropium. Option C, methylprednisolone. Option D, montelukast. The correct answer is option A, albuterol. Albuterol, a short-acting beta agonist, provides rapid bronchodilation and is first line for acute bronchospasm. Question 43. The nurse is assessing for fluid responsiveness. A patient with a pulse pressure variation of 15% on controlled mechanical ventilation is likely: Option A, not fluid responsive. Option B, fluid responsive. Option C, in heart failure. Option D, hypervolemic. The correct answer is option C, in heart failure. ppV 13% suggests the patient is fluid responsive and will increase cardiac output with fluids. In this rotation, C is the correct position. Question 44. In distributive shock, the primary pathophysiology is: Option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option D, obstruction of blood flow. Distributive shock is characterized by profound vasodilation and maldistribution of blood flow. In this rotation, D is the correct position. Question 45. A patient taking metformin develops lactic acidosis. The nurse should expect: Option A, metabolic alkalosis. Option B, high anion gap metabolic acidosis with elevated lactate. Option C, respiratory acidosis. Option D, normal ABG. The correct answer is option A, metabolic alkalosis. Metformin-associated lactic acidosis causes a high anion gap metabolic acidosis with markedly elevated lactate. In this rotation, A is the correct position. Question 46. The typical presentation of autonomic dysreflexia includes: Option A, severe hypotension and bradycardia. Option B, severe hypertension, pounding headache, and diaphoresis above the injury level. Option C, fever and muscle spasms. Option D, decreased level of consciousness. The correct answer is option B, severe hypertension, pounding headache, and diaphoresis above the injury level. Autonomic dysreflexia causes severe hypertension, headache, flushing, and diaphoresis above the level of injury. Question 47. A patient with a pulmonary contusion is at highest risk for developing: Option A, pneumothorax. Option B, acute respiratory distress syndrome, ARDS. Option C, pneumonia. Option D, pleural effusion. The correct answer is option B, acute respiratory distress syndrome, ARDS. Pulmonary contusion causes inflammation and capillary leak, which can progress to ARDS over 24 to 48 hours. Question 48. A patient with Fournier's gangrene requires: Option A, outpatient antibiotics. Option B, immediate surgical debridement and broad-spectrum antibiotics. Option C, observation only. Option D, antiviral therapy. The correct answer is option D, antiviral therapy. Fournier's gangrene is a life-threatening necrotizing fasciitis of the perineum requiring urgent surgery. In this rotation, D is the correct position. Question 49. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to: Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option D, patients with urgent conditions only. EMTALA mandates a medical screening exam for any individual presenting to a Medicare participating ED, regardless of ability to pay. In this rotation, D is the correct position. Question 50. The emergency nurse suspects acute epiglottitis in a patient presenting with: Option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, and tripod positioning. Question 51. A patient with a hyphema should be positioned: Option A, flat with the affected eye down. Option B, with the head of bed elevated 30 to 45 degrees. Option C, prone. Option D, in Trendelenburg. The correct answer is option B, with the head of bed elevated 30 to 45 degrees. Head elevation helps settle blood in the anterior chamber and reduce rebleeding risk. Question 52. Which ABG finding would the nurse expect in a patient hyperventilating due to anxiety? Option A, pH 7.48, PaCO 230, HCO 324. Option B, pH 7.32, PaCO 250, HCO 324. Option C, pH 7.30, PaCO 230, HCO 318. Option D, pH 7.42, PaCO 240, HCO 324. The correct answer is option A, pH 7.48, PaCO 230, HCO 324. Acute respiratory alkalosis from hyperventilation, elevated pH, low PaCO2, normal HCO3. Question 53. A patient receiving massive blood transfusion is at risk for hypocalcemia due to Option A, hyperkalemia. Option B, citrate preservative in blood products chelating ionized calcium. Option C, hemodilution only. Option D, increased calcium excretion. The correct answer is option A, hyperkalemia. Citrate in transfused blood binds ionized calcium, causing hypocalcemia, which can lead to paresthesias and cardiac dysrhythmias. In this rotation, A is the correct position. Question 54. A patient requires restraints for violent behavior. The nurse must: Option A, apply restraints and check only at the end of shift. Option B, obtain a physician's order as soon as possible, assess circulation frequently, and document. Option C, use restraints without any documentation. Option D, leave the patient unattended while restrained. The correct answer is option D, leave the patient unattended while restrained. Restraints require orders, frequent assessment, and documentation. In this rotation, D is the correct position. Question 55. A patient with diabetes insipidus has a serum sodium of 155 milliequivalent/L. The nurse expects to administer: Option A, hypertonic saline. Option B, desmopressin, DDAVP, and hypotonic fluids. Option C, fluid restriction. Option D, diuretics. The correct answer is option B, desmopressin, DDAVP, and hypotonic fluids. DDAVP replaces antidiuretic hormone. Hypotonic fluids correct the hypernatremia from water loss. Question 56. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates: Option A, normal cellular metabolism. Option B, hypoperfusion and anaerobic metabolism. Option C, kidney failure. Option D, liver failure. The correct answer is option A, normal cellular metabolism. Elevated lactate, greater than 2 mol/L, is a marker of tissue hypoperfusion and anaerobic metabolism. In this rotation, A is the correct position. Question 57. The nurse is triaging 4 patients. Which should be seen first? Option A, a 5-year-old with a fever of 101 degrees Fahrenheit and sore throat. Option B, a 40-year-old with flank pain and suspected kidney stone. Option C, a 65-year-old with sudden onset chest pain, diaphoretic and nauseated. Option D, a 25-year-old with an ankle sprain. The correct answer is option C. A 65-year-old with sudden onset chest pain, diaphoretic and nauseated. The 65-year-old has signs of possible acute coronary syndrome, a life-threatening emergency requiring immediate evaluation. Question 58. A patient with cirrhosis and ascites undergoes paracentesis. The nurse should monitor for option A, hypertension. Option B, hypotension due to fluid shifts. Option C, bradycardia. Option D, hyperthermia. The correct answer is option B. Hypotension due to fluid shifts. Large volume paracentesis can cause post-procedure hypotension from fluid shifts. Question 59. Which of the following is a contraindication to fibrinolytic therapy in acute STEMI? Option A, age greater than 65. Option B, history of ischemic stroke within 3 months. Option C, anterior wall MI. Option D, chest pain duration of 4 hours. The correct answer is option C. Anterior wall MI. Recent ischemic stroke is an absolute contraindication. In this rotation, C is the correct position. Question 60. A patient with a scorpion sting may present with option A, localized pain only. Option B, neurotoxicity with cranial nerve dysfunction and autonomic instability. Option C, hemorrhage. Option D, only allergic reaction. The correct answer is option A. Localized pain only. Certain scorpion species, e.g., centruroids, cause neurotoxicity with cranial nerve abnormalities and autonomic storm. In this rotation, A is the correct position. Question 61. The most common cause of acute liver failure in the United States is option A, acetaminophen overdose. Option B, hepatitis B infection. Option C, alcohol abuse. Option D, autoimmune hepatitis. The correct answer is option B. Hepatitis B infection. Acetaminophen toxicity is the most common cause of acute liver failure in the U.S. In this rotation, B is the correct position. Question 62. A patient with a head injury has unequal pupils. The nurse knows this is most likely due to option A, congenital anisocoria. Option B, oculomotor nerve, CN3, compression from increased ICP. Option C, eye trauma. Option D, medication effect. The correct answer is option C. Eye trauma. Unilateral pupil dilation suggests ipsilateral CN3 compression from uncal herniation. In this rotation, C is the correct position. Question 63. The nurse is caring for a patient post-TPA for ischemic stroke. The BP suddenly rises to 210/120. The nurse should option A, administer labetalol as ordered and stop TPA if still infusing. Option B, continue monitoring without intervention. Option C, administer more TPA. Option D, administer hydralazine. The correct answer is option A. Administer labetalol as ordered and stop TPA if still infusing. Severe hypertension during/after TPA increases hemorrhage risk. It must be aggressively managed. Question 64. A female patient of childbearing age with abdominal pain should always be evaluated for option A, pregnancy status. Option B, ovarian cysts. Option C, endometriosis. Option D, PID. The correct answer is option A. Pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out ectopic pregnancy. Question 65. A patient with cholecystitis is being evaluated. Which laboratory finding is most consistent? Option A, elevated amylase. Option B, elevated lipase. Option C, elevated alkaline phosphatase and bilirubin. Option D, decreased WBC count. The correct answer is option D. Decreased WBC count. Elevated alkaline phosphatase and bilirubin suggest biliary obstruction. In this rotation, D is the correct position. Question 66. The antidote for cyanide poisoning is: Option A, naloxone. Option B, hydroxycobalamin, cyanoacate, or sodium thiosulfate. Option C, atropine. Option D, N-acetylcysteine. The correct answer is option D, N-acetylcysteine. Hydroxycobalamin binds cyanide directly. Sodium thiosulfate enhances endogenous detoxification. In this rotation, D is the correct position. Question 67. A patient with warm, flushed skin and bounding pulses in shock likely has: Option A, hypovolemic shock. Option B, cardiogenic shock. Option C, distributive shock, early sepsis, neurogenic. Option D, obstructive shock. The correct answer is option A, hypovolemic shock. Warm skin with bounding pulses suggests vasodilation, characteristic of distributive shock. In this rotation, A is the correct position. Question 68. A patient presents with tearing chest pain radiating to the back, BP differential between arms, and widened mediastinum on CXR. The nurse suspects: Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, BP differential between arms, and widened mediastinum is the classic presentation of thoracic aortic dissection. Question 69. The nurse is caring for a patient who speaks a different language. The best approach is: Option A, use family members as translators for all communication. Option B, use professional interpreter services. Option C, speak loudly in English. Option D, use hand gestures only. The correct answer is option A, use family members as translators for all communication. Professional interpreters ensure accurate communication and maintain confidentiality. In this rotation, A is the correct position. Question 70. A patient with severe hypothyroidism may have which cardiovascular finding? Option A, tachycardia. Option B, bradycardia and pericardial effusion. Option C, hypertension. Option D, bounding pulses. The correct answer is option B, bradycardia and pericardial effusion. Hypothyroidism causes bradycardia, low cardiac output, and can cause pericardial effusion. Question 71. The initial management priority for a patient with suspected acute GI bleeding is: Option A, endoscopy. Option B, assessment and stabilization of airway, breathing, and circulation. Option C, administration of antibiotics. Option D, immediate blood transfusion. The correct answer is option B, assessment and stabilization of airway, breathing, and circulation. As with any emergency, ABC assessment and stabilization take priority before diagnostic procedures. Question 72. The classic triad of symptoms for a ruptured abdominal aortic aneurysm includes: Option A, hypertension, bradycardia, headache. Option B, abdominal or back pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D dysuria, frequency, urgency. The correct answer is option A. Hypertension, bradycardia, headache. The classic triad is abdominal/back pain, hypotension, and a palpable pulsatile mass. In this rotation, A is the correct position. Question 73. A patient with a severe traumatic brain injury has an ICP of 25 mmHg and MAP of 85 mmHg. The CPP is option A 60 mmHg, option B 110 mmHg, option C 85 mmHg, option D 25 mmHg. The correct answer is option C, 85 mmHg. CPP equals MAP, ICP equals 85 to 25 equals 60 mmHg. In this rotation, C is the correct position. Question 74. A patient with acute angle closure glaucoma presents with option A gradual vision loss, option B sudden severe eye pain, cloudy cornea, fixed mid-dilated pupil, and increased IOP. Option C painless vision loss, option D bilateral eye discharge. The correct answer is option C, painless vision loss. Angle closure glaucoma causes sudden severe eye pain, cloudy cornea, and fixed mid-dilated pupil. In this rotation, C is the correct position. Question 75. A trauma patient with significant blood losses and decompensated hemorrhagic shock. Which finding would the nurse expect to see last? Option A tachycardia, option B narrowed pulse pressure, option C hypotension, option D tachypnea. The correct answer is option C, hypotension. Hypotension is a late and ominous sign of shock, especially in young, healthy patients who can compensate until significant blood loss. Question 76. The gold standard for diagnosing pulmonary embolism is option A D-dimer assay, option B chest X-ray, option C CT pulmonary angiography, option D ventilation perfusion scan. The correct answer is option A, D-dimer assay. CT pulmonary angiography is the gold standard for PE diagnosis. In this rotation, A is the correct position. Question 77. A patient with cholecystitis has a positive Murphy's sign. To elicit this sign, the nurse palpates option A, the right upper quadrant during deep inspiration, option B, the left lower quadrant during expiration, option C, the epigastrium with the patient supine, option D, the flank with percussion. The correct answer is option D, the flank with percussion. Murphy's sign is elicited by palpating the RUQ during inspiration, causing pain and inspiratory arrest. In this rotation, D is the correct position. Question 78. A patient with pelvic inflammatory disease typically presents with option A unilateral sharp pain, option B bilateral lower quadrant pain, cervical motion tenderness, and purulent discharge, option C painless vaginal bleeding, option D epigastric pain. The correct answer is option C, painless vaginal bleeding. PID presents with bilateral adnexal tenderness, cervical motion tenderness, and often mucopurulent discharge. In this rotation, C is the correct position. Question 79. A patient with DIC, disseminated intravascular coagulation, has which laboratory findings? Option A elevated platelets, decreased patient/PTT, decreased D-dimer. Option B decreased platelets, prolonged patient/PTT, elevated D-dimer, decreased fibrinogen. Option C, normal platelets, normal coagulation studies. Option D, increased fibrinogen only. The correct answer is option B. Decreased platelets, prolonged patient/PTT, elevated D-dimer, decreased fibrinogen. DIC causes consumption of clotting factors and platelets, leading to thrombocytopenia, prolonged coagulation times, elevated D-dimer, and low fibrinogen. Question 80. Clear fluid draining from the nose of a head-injured patient tests positive for glucose. This indicates Option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, cerebrospinal fluid leak. Option D, sinusitis. The correct answer is option D, sinusitis. CSF contains glucose while normal nasal secretions do not. Glucose-positive clear drainage after trauma indicates a CSF leak. In this rotation, D is the correct position. Question 81. The most common cause of acute pancreatitis is Option A, gallstones and chronic alcohol use. Option B, hypertriglyceridemia. Option C, medications. Option D, trauma. The correct answer is option D, trauma. Gallstones and alcohol account for the majority of acute pancreatitis cases. In this rotation, D is the correct position. Question 82. A drowning victim submerged in cold water has a higher potential for successful resuscitation because Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Hypothermia reduces cerebral metabolic rate and oxygen demand, allowing for survival and neurological recovery after prolonged submersion. Question 83. Which of the following is a complication of prolonged nasogastric suctioning? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. Prolonged NG suction removes gastric acid, causing metabolic alkalosis. In this rotation, C is the correct position. Question 84. Which of the following is a contraindication to TPA administration for ischemic stroke? Option A, age over 80. Option B, blood glucose of 180 mg/dl. Option C, recent intracranial surgery within 3 months. Option D, mild stroke symptoms. The correct answer is option A, age over 80. Recent intracranial or spinal surgery is an absolute contraindication to TPA. In this rotation, A is the correct position. Question 85. A patient receiving 4-nitroglycerin for chest pain develops a severe headache. The nurse should Option A, stop the nitroglycerin immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option D, switch to oral nitrates. Headache is a common side effect of nitrates. Analgesics can be given while continuing therapy. In this rotation, D is the correct position. Question 86. Magnesium sulfate is administered to a patient with severe preeclampsia to Option A, lower blood pressure. Option B, prevent seizures, eclampsia. Option C, induce labor. Option D. Treat infection. The correct answer is option A. Lower blood pressure. Magnesium sulfate is the drug of choice for seizure prophylaxis in severe preeclampsia. In this rotation, A is the correct position. Question 87. The initial treatment for myxedema coma includes Option A. 4-levothyroxine and supportive care. Option B. Antithyroid medications. Option C. Beta blockers. Option D. Radioactive iodine. The correct answer is option C. Beta blockers. Myxedema coma requires 4 thyroid hormone replacement and supportive measures. In this rotation, C is the correct position. Question 88. A patient with atrial fibrillation not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A. Acute deep vein thrombosis. Option B. Acute arterial occlusion from embolism. Option C. Severe cellulitis. Option D. Compartment syndrome. The correct answer is option B. Acute arterial occlusion from embolism. The sudden onset of the 6PS in a patient with AF suggests an embolic arterial occlusion from a cardiac thrombus. Question 89. A patient with a stab wound to the neck has expanding hematoma and stridor. The nurse anticipates Option A. Observation only. Option B. Immediate airway management with possible intubation or cricothyrotomy. Option C. Antibiotics only. Option D. Cold compresses. The correct answer is option C. Antibiotics only. Expanding neck hematoma with stridor indicates impending airway compromise. In this rotation, C is the correct position. Question 90. The most effective cooling method for exertional heat stroke is Option A. Antipyretics. Option B. Ice water immersion. Option C. Evaporative cooling with tepid water. Option D. Cooling blankets only. The correct answer is option A. Antipyretics. Ice water immersion provides the most rapid cooling rate for exertional heat stroke. In this rotation, A is the correct position. Question 91. A patient with hyperglycemic hyperosmolar state, HHS, typically requires Option A. Aggressive for fluids and insulin therapy. Option B. Observation only. Option C. Oral hypoglycemics only. Option D. Glucagon. The correct answer is option D. Glucagon. HHS requires aggressive fluid resuscitation and insulin therapy, similar to but distinct from DKA management. In this rotation, D is the correct position. Question 92. The proper needle size and location for needle decompression of a tension pneumothorax is Option A. 14 to 16 gauge, second intercostal space, mid-clavicular line. Option B. 18 gauge, fourth intercostal space, mid-axillary line. Option C. 22 gauge, second intercostal space, anterior axillary line. Option D. 16 gauge, fifth intercostal space, mid-axillary line. The correct answer is option A. 14 to 16 gauge, second intercostal space, mid-clavicular line. Needle decompression is performed with a 14 to 16 gauge needle in the second intercostal space at the mid-clavicular line. Question 93. Which of the following is a classic sign of hypocalcemia? Option A. Kvostek's sign and Trousseau's sign. Option B. Muscle weakness and hyporeflexia. Option C. Bradycardia. Option D. Polyuria. The correct answer is option C. Bradycardia. Kvostek's sign, facial twitch with tapping, and Trousseau's sign, carpal spasm with BP cuff, indicate hypocalcemia. In this rotation, C is the correct position. Question 94. The most common cause of postmenopausal vaginal bleeding is: Option A, endometrial cancer. Option B, vaginal atrophy. Option C, cervical cancer. Option D, uterine fibroids. The correct answer is option A, endometrial cancer. While atrophy is common, endometrial cancer must be ruled out in all postmenopausal bleeding. In this rotation, A is the correct position. Question 95. The antidote for acetaminophen overdose is: Option A, naloxone. Option B, N-acetylcysteine. Option C, flumazenol. Option D, sodium bicarbonate. The correct answer is option A, naloxone. N-acetylcysteine replenishes glutathione stores, allowing safe metabolism of the toxic napki metabolite. In this rotation, A is the correct position. Question 96. A patient with a 45% TBSA partial thickness burn weighs 70 kilograms. Using the Parkland formula, the total fluid requirement in the first 24 hours is: Option A, 6,300 ml. Option B, 12,600 ml. Option C, 18,900 ml. Option D, 25,200 ml. The correct answer is option C, 18,900 ml. 4 ml x 70 kg x 45% equals 12,600 ml in 24 hours. Half, 6,300 ml, is given in the first 8 hours. In this rotation, C is the correct position. Question 97. Which medication is most commonly associated with drug-induced hyperglycemia? Option A, antibiotics. Option B, corticosteroids. Option C, antihistamines. Option D, anticoagulants. The correct answer is option A, antibiotics. Corticosteroids cause insulin resistance and increased gluconeogenesis, leading to hyperglycemia. In this rotation, A is the correct position. Question 98. The initial management for a patient with an acute spinal cord injury includes: Option A, immediate ambulation. Option B, immobilization and high-dose methylprednisolone per protocol. Option C, application of heat to the spine. Option D, massage of the affected area. The correct answer is option C, application of heat to the spine. Spinal immobilization is critical. Methylprednisolone use is controversial but still used in some protocols. In this rotation, C is the correct position. Question 99. A patient with neutropenia, low WBC count, should be placed on: Option A, standard precautions only. Option B, protective, reverse, isolation. Option C, contact precautions. Option D, airborne precautions. The correct answer is option D, airborne precautions. Neutropenic patients are at high risk for infection and require protective isolation to minimize exposure. In this rotation, D is the correct position. Question 100. Which of the following patients with pneumonia meets criteria for severe sepsis? Option A, a 45-year-old with fever and productive cough. Option B, a 70-year-old with confusion, RR30, SBP 85, and lactate 4.5. Option C, a 30-year-old with pleuritic chest pain. Option D, a 50-year-old with cough and normal vital signs. The correct answer is option C, A 30-year-old with pleuritic chest pain. The 70-year-old has signs of organ dysfunction, confusion, tachypnea, hypotension, elevated lactate. In this rotation, C is the correct position.